Total Gym is perhaps the most versatile piece of equipment I have in my office. And if I were to start an office from scratch, or if I were going to have one piece of equipment that I was going to use when traveling to patients' homes, it would be the Total Gym.
As the main partner in our practice, it's probably the most cost-effective piece of equipment that we've ever owned because it can do so many different things.
The gravity equipment has allowed us to not only customize the class in a mixed group, but also to offer a variety of workouts so that you're really able to gear for multiple fitness levels.
When I teach physical therapy students, I frequently tell them the only time you see the body working in cardinal planes is in gyms and in PT clinics. And the Total Gym allows you to train the body in the way that it's meant to be used and the way that it's built to be used, and not under the constraints of the fitness equipment that you happen to have.
I work with a lot of kids with cerebral palsy and some other diagnoses, and I'm working with tone, and I think if you can stretch and then strengthen, which I could use with this machine, I think their functional outcome would be better.
Once I set it up, it's just go, whereas some of the free weight exercises or even some of the other machine exercises, you can lose form and lose focus on exactly the muscle that you're looking to kind of train. One
of the things that the GTS equipment allows us to do is to address the cardiovascular component of our patients' fitness needs, and that's more difficult to do on some of our more stationary equipment.
There's not any other piece of equipment that I can put them on that gives them partial weight to try and work on that motor control.
This class, because you're on this piece of equipment and it's really controlled, is a lot more conducive to strength training for me without injuring myself.
What we like about the closed kinetic chain lower extremity activities is that you can grade the exercises. So I can get a 300-pound football player on there and really work them on hard, but at the same time I can get my 80-year-old osteoporotic female and really have an appropriate workout regimen for her as well.
Patients love it because they can move on it and it feels smooth, and they can feel success without failure.
For us, we needed a single piece of equipment that was flexible in terms of space, and there's really no other piece of equipment out there that offers that kind of flexibility.
The space for one unit of gravity equipment or Total Gym equipment is no more than the size of a treatment table or any other exercise apparatus that we would typically use in physical therapy.
We can fold it up, move it out of the way, unfold it, hold a class, and be able to adapt it to whatever our needs happen to be.
The durability of the Total Gym is pretty remarkable. It's darn near bulletproof.
I can't think of another piece of equipment that is as flexible, is as adaptable to what our patients and clients' needs happen to be.
We've always had an understanding that the continuum from rehab to fitness was an important part of our whole practice paradigm. The gravity training just allowed us to do that, I think, more completely.
If your practice is dealing with movement and movement impairments, I think the Total Gym can be a great adjunct to what you're doing.
I couldn't do what I do without this piece of equipment in our office.